Okay, we're doing autoimmune disease part 3. It's from the book John Mcdougall, the Doctor Who Fought for You, written by me, Pete Rogers. And all of this information will be on Dr. John Mcdougall's website at drmcdougall.com or at Dr. Mcdougall's YouTube channel. I basically summarized all his work in this book because, he's the greatest doctor in the world and I want to be the greatest doctor in the world. Okay, so we start out here and he says there are lots of autoimmune diseases, including autoimmune alopecia, all the hair loss. That's what Cyrus Khambatta has, the guy from Mastering Diabetes. He lost his eyebrows as well. Ankylosing spondylitis, where the entire spine becomes all fused together at a young age. Crohn's disease, diabetes type 1, associated with milk. Lupus, like systemic lupus erythematosus, same thing, SLE, lupus. Multiple sclerosis, MS, psoriasis. Kepner had tons of patients just getting cured from eating his rice diet when they had psoriasis. Scleroderma. The one thing, too, I've seen a lot of people, because I know people who got autoimmune disease that come talk to me, is the typical pro, they don't get it. When you are sick, you are sick. That means your body cannot heal. It can't catch up with the illness. So you have to do everything 100%. What a lot of people do is they do things half-ass. With a half-ass, you don't get much of a result. You want to go 100% vegan, no oil, and then see if that works. And if it doesn't work, then start adding other things and maybe cut out on the gluten grains. Okay, and if you still haven't got it, get the F- out of your water. See if that does it. Make sure you're only eating organic. Get the GP out of there. Okay, you want to keep on doing more things until you cure the disease. You don't want to just do it half-ass, go, oh well, it doesn't work, and then stay on these those toxic drugs, methotrexate and stuff the rest of your life. All right. Scleroderma, rheumatoid arthritis, JRA, juvenile rheumatoid arthritis, thyroiditis. I see tons of Hashimoto's. A lot of Graves as well. Ulcerative colitis, uveitis, vitiligo. Okay, obesity is associated with increased risk of inflammatory arthritis. Okay, autoimmune diseases have a characteristic worldwide distribution. Yeah, it matches where people eat meat and oil, okay? Especially northern areas because they tend to have less fruits available year-round, less plant foods. And it's not the vitamin C because they've shown that, like in Norway, the people who were in the central dairy area had a lot of MS, but not in the coastal areas where they ate less dairy. Okay, it's true for type 1 and other diseases. You'll see it. You can just type it in your computer browser, global distribution of any of these diseases, and you'll see that they'll match that northern distribution pattern of the Western diseases typically. Nowadays, there was like no lupus in Africa before 1960. Nowadays, in USA and black women, it's like the most common thing. In Africa, rheumatoid arthritis used to be rare. There was like not a single case known before like 1957. By 1975, the more westernized the diet, the more they'll get of all these diseases. Roy Swank couldn't find any MS in China around 1960 when I went out there because they all ate that 90% of their calories from white rice, plant foods, and some veggies and whatnot. But now that China is becoming more westernized in its diet, it's getting more Western diseases, obesity, and everything else. That happens to all those countries. Same thing in Japan. When multiple sclerosis patients ate the Mcdougall diet for 1 year, they noticed a significant improvement in fatigue and showed trends for improvement in mental health quality of life over 1 year's duration in comparison with controls. The reference is Mcdougall study on fatigue and MS. After the age of 4 years old, 75% of the world population can't digest milk. With milk, the amount of fat is reduced. With skim milk, that should be skim milk. With skim milk, the amount of fat is reduced, and then the percent of calories from protein and lactose is increased, so that's not good. Whole milk's about 50% fat. Okay. Skim milk still has a little bit of fat, 0 to 2% of the calories from fat. A lot of people, even if you can split the lactose in your gut into glucose and galactose, it doesn't mean you can handle the galactose. Galactose is toxic. It increases your risk of cataracts. Oh, here we go. Increases the risk of cataracts. It can also be toxic to the ovaries, increase the risk of ovarian cancer. Cow's milk, I think, is the most common cause of cataract. There's other things that can cause cataract. Some of the preservatives in the contact lens things are toxic. If you're working as an imaging guided surgeon, if you don't have good eye protectors, I used to wear these big, thick glasses that were eye protectors, so I never had a problem. My eyesight, I actually went to the eye doctor when I was a lot younger, when I was like in my late 30s, and he said, oh, there's a hint of a little cataract there. You might want to watch out for that. And I had contact lenses at that time with the preservative, and I was doing a lot of the interventional cases. My eyesight and I became a vegetarian, then a vegan. My eyesight is completely unchanged since I was in my 30s. It's fine. Okay, I'm not wearing any glasses, not any contact lenses. That's fine. Okay. I do wear glasses for driving, but I've done that ever since I was like a teenager. My eyes have been, I got the same glasses for decades. My prescription doesn't change. Okay, let's see what else. Pasteurization does not kill bovine leukemia virus or mad cow disease. Mad cow is super rare. Just to let you know, I'm a neuroradiologist. It's one of the things I do. And in all these years, I can tell you, in the last 25 years, how many cases of mad cow have I seen? I've only seen 2. It's really, 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 really rare. Okay, what do I see? It's like, getting bit by a shark. What do I see all day long, nonstop, every day? Endless, endless number of patients. Hypertension, diabetes, hypertension, diabetes, hypertension, diabetes, and the result in atherosclerosis, atrial fibrillation, congestive heart failure, all that stuff. All day long, nonstop. Okay, let's see. You talked about cataracts being associated with dairy, with meat, with high fat intake, previous eye surgery, eye trauma, steroid medications, corticosteroid medications. Okay, and that's the thing I usually see. When you show me, if you just told me this patient has cognitive impairment, and I wouldn't even look at the scan. I would just assume they probably had cataract surgery in one eye. They probably had poor dentition. It all goes together. Sort of a stupid person doesn't take care of their teeth and their eyes are messed up because of all these bad habits. Okay, does milk have keratogenic effects? There's a paper on it. High-frequency lactose absorbers among adults with idiopathic senile cataract, presenile cataract. Okay, suggesting that, yeah, they do. Okay, so a whole bunch of papers on milk and increased risk of cataracts. Another reason not to drink milk. So there's just a bunch more papers on cataracts and milk. Okay, you can also get kidney problems. Dr. Mcdougall really doesn't like dairy and all the problems of it, but it's really bad. The more you study milk, it makes people constipated, it increases their autoimmune disease, it increases their coronary artery disease, it increases their risk of breast cancer, it increases their risk of prostate cancer. It's bad. You don't want anything to do with it once you learn about it. No animal drinks the milk of another species after it's weaned. Okay, talking about membranous nephropathy in kids. We talked about Hashimoto's. I see Hashimoto's routinely. Tons of women have thyroid problems. Okay, and I also told you about those estrogenic chemicals. I made a video just like a day or two ago about the forgotten cause of thyroid failure. And so there's F- in your water. There's bromine in a lot of pools. There's bromine in the flame retardants. They're bad for the thyroid. What else do I see? I told you about the estrogenic chemicals. The cruciferous vegetables are a little bit goitrogenic. Soy is goitrogenic. They're all bad for the thyroid. Mcdougall talked about a hot dog is basically taking an animal and throwing it in a blender, and you're going to grind up its thyroid. Then if you got leaky gut because you eat a high-fat diet, you'll get some, and not enough fiber, you'll get some of that thyroid tissue across the gut barrier from the leaky gut. Antibodies will form to it, and because it's a sequence from an animal, the amino acid sequence in the protein of the thyroid, it'll cross-react with your own thyroid protein. So that's autoantibody cross-reactivity is a mechanism. Leaky gut with autoantibody, molecular mimicry and autoantibody cross-reactivity as the most common mechanism of autoimmune disease. So what do? You stop eating those hot dogs. You stop eating all animal foods. And you eat a lot of fiber to protect you from having leaky gut. And you avoid all the other stuff. That's what I would do before I would take medicines. I would try to fix the problem first and maybe not even have to take medicines. Let's see. So we talked about that mechanism of thyroid. I have a separate lecture on thyroid if you guys want to see that. Dr. Mcdougall has a very good lecture on autoimmune disease. Okay, because yeah, once the thyroid goes too far down the path of being damaged, it's probably not going to come back. So you got to try to fix it as fast as possible before you trash all your thyroid functional tissue. I've seen plenty of thyroid ultrasounds. End-stage Hashimoto's, the things eventually trash. But a lot of patients, if they catch it early enough, they can turn things around. Celiac disease is the ultimate insensitivity to gluten. They really got to avoid that stuff. It's only about 1% of the population or fewer. High gluten containing foods, or especially rye, barley, and wheat. Starches that are low in gluten would be potatoes, sweet potatoes, rice, millet, quinoa. Here's improvement of inflammation and pain after 3 months exclusion diet in rheumatoid arthritis patients. Okay, long-standing, well-controlled RA. They got better control of their inflammation. The Mcdougall study on rheumatoid arthritis, effects of a very low-fat vegan diet in subjects with RA. Mcdougall had really good results in his patients. Okay. Okay, vegan diet often alleviates the symptoms of fibromyalgia. And the symptoms of fibromyalgia, that's a complex disease. There's different theories of fibromyalgia. So number one, it's an autoimmune disease. That's one theory. Number two, there's the intracranial hypertension theory of fibromyalgia. A fat person, the big belly pushes on the cava, inferior vena cava. The increased venous pressure is transmitted to the superior vena cava, transmitted to the brain, venous intracranial hypertension. And that can have a little bit of a pressure effect on exiting nerve roots and cause these vague symptoms. Okay, that's one of the theories of fibromyalgia. Okay, the other theory of fibromyalgia is the Martin Pall no theory. Okay, I've just talked about that extensively in my recent lecture on congestive heart failure. It applies to other areas of the body. So the smart thing is, one of the great things, you go low-fat vegan, you get skinny, so you avoid the obesity component of that. You eat a lot of fiber, so you avoid the leaky gut component of that. And basically, I showed how when you go down this path of low fat, low sodium, 100% vegan, whole foods, all organic, no oils, you basically reverse most of the problems with the no cycle. Okay, and Mcdougall would often say, the patient doesn't need to understand all the details. They just have to know to follow the diet. And that's true, but knowing the details motivates you more to follow the diet. When you understand food more, have a better understanding of nutrition, you'll look at processed food as like a poison. You say, why would I want to poison myself with that crap? No, you don't want to eat it. Okay, we talked about schizophrenia also being a Western disease, likely autoimmune disease. I have previous lectures on that one too with soteria and all that stuff. And Dr. Mcdougall talked about schizophrhrenia looking like it's an autoimmune disease. And I can also tell you the medicines for schizophrenia, like those antipsychotics, are terrible medications. They cause a chemical lobotomy. All right, hidden role of gut microbiome dysbiosis in schizophrenia, antipsychotics, and psychobiotics as therapeutics, neuroscience behavior. This is one of the great things Mcdougall does. Like I said, Dr. Mcdougall knew the literature of health and nutrition, especially before 2000, but he kept up pretty well up into 2020 or so. He knew it quite well, and he does a good job of having all these references. So basically, if you're going to debate somebody about, the common Western diseases and the internal medicine type diseases, go to Mcdougall, you'll have all these great references, and they'll be the best ones. So it's very powerful. His lectures and his information are very good. I can tell you, he's the best one. He was the best one. I studied all of them, okay? He had the most comprehensive knowledge and the ability to put things together and get to the key points. So autism, some believe, is partially autoimmune disease. There's a lot of different causation theories of autism. One of them is MSG, monosodium glutamate, the excitotoxins. So anyways, that's it for this session on autoimmune disease. Hope that was helpful.